For our nursing leadership class at Schoolcraft, we were required to find a quality improvement project at our designated facility. One thing stood out to us. The nurses are so dedicated to their job that they forget to take care of themselves. While on our unit, it became clear to us that even when the nurses would take their break, they would be interrupted with issues with their patients. We tried to figure out something that we could do to help. The solution we came up with did not go exactly as planned, and we decided that a little education can go a long way. This presentation will give an interesting perspective to the nurses that so deserve the time that is given to them.
Along with our survey, we had a discussion with the assistant nurse manager of the unit regarding the nurses and their break schedule. Hassan, the nursing manager, stated that it is very difficult to schedule breaks for the nurses because he cannot force them to take their breaks, although he was willing to try the break schedule that we introduced to him. In our discussion, we agreed there were several factors involved in a nurse being able to take a break. Factors such as being behind on MedPass, a patient emergency, phone calls, and other interruptions that prolong the chance to take a break.
We conducted a survey consisting of 10 questions inquiring if the nursing staff on our unit took breaks. If they did take their allotted breaks, we also asked if they were uninterrupted, if they felt refreshed after, if someone covered for them, and if they felt like their 15 minutes at a 30-minute break were fair for a 12-hour shift. The answers to the questions ranged from never, rarely, sometimes, often, and always. This allowed us to collect and quantify measurable data on the unit and correlate it to burnout and compassion fatigue.
Our pre-survey consisted of 10 questions. This helped us determine what to focus on in our teaching presentation to the staff. Statistics show there was some room for improvement. When examining these statistics, we noticed the company and the nurses had some work to do. The company needed to make sure they were well staffed so the nurses could get enough breaks and that they were uninterrupted. The nurses needed to take the initiative to report off and take the breaks they desperately need. Some ideas we came up with to help remind the nurses to take a break included posting a lunch schedule on the patient board. We understand nursing never goes by the clock, so we decided the schedule should be filled out by each individual nurse. 45-minute slots were left blank for the nurse to fill their name in, as well as their buddy's name that would be covering for them. Another idea was to spice up the resting room that the hospital had provided for the employees. In addition to the recliner and solitude, we thought some therapeutic plants and relaxing music would enhance the experience. However, the most important change we hoped to bring was the breaks actually being uninterrupted, meaning the nurse's phone needed to be passed on to their buddy so that the nurse did not feel obligated to answer a call, as well as patient care did not suffer by having the call ignored.
One way to look at the benefit of taking your breaks and lunches is how much you are giving away for free by not taking them. Most nurses in a hospital setting work a 12.5-hour day with 3 paid breaks and a half an hour unpaid lunch. Every institute is different on how they combine these breaks and lunches, but on average that is the case. If you take the amount of time that you get for the breaks and lunches for 3 12.5-hour shifts, you have 195 hours of your time to do what you want with. Within reason, there's almost $2,900 that the company is keeping because someone is deciding to work for free.
So you're wanting to know the difference in compassion fatigue and burnout. According to Webster's dictionary, compassion fatigue is the physical and mental exhaustion and emotional withdrawal experienced by those who care for the sick or traumatized people over an extended period of time. If untreated, burnout can occur. Compassion fatigue is usually sudden and may not be recognized as such. The symptoms are similar to those of anxiety and depression, which is why compassion fatigue can be overlooked when certain symptoms occur. Burnout, on the other hand, is exhaustion of physical or emotional strength or motivation, usually as a result of prolonged stress or frustration.
In a study done on an oncology unit in Pittsburgh, 61 nurses were asked about their break time, their perception of burnout, and if they feel that it affects patient care. This study found that nurses felt that not taking breaks or only taking part of their breaks caused burnout due to emotional exhaustion and detachment. Burnout can directly affect how well you perform emotionally and physically. The nurses think that with collaboration, teamwork, and resources, this can be prevented and preserve the compassion needed for a positive nurse-patient relationship.
A study in 2020 determined a correlation between nurse burnout and the physical and mental effects that it has. Nurses suffering from burnout may experience lower cognitive functioning due to emotional exhaustion. Evidence also says that infrequent breaks and long work hours slows down reaction times. It decreases motivation and increases errors. In a 30-day period, 83% of nurses say they suffered an average of 8 days of poor physical health and an average 10 days from poor mental health. Headaches and body aches are the most frequently reported, followed by sleep disruption, anxiety and depression, and extreme or chronic fatigue. This not only affects the nurses, it also puts our patient safety at risk as well. After presenting our data about the nursing staff and their breaks, we supplied a post-survey that would allow us to see if they were more likely to take their breaks. 100% said that they would encourage their team members to go on break, 30% are more likely to take their break, 90% had a better understanding of burnout, and 30% felt that handing off their work phone to a buddy could be implemented and used to allow for uninterrupted breaks. Our presented data had a small impact on the staff, but some impact is better than none.
In conclusion, we saw that the nurses were not taking breaks. We asked for their input regarding our observations, and we did some research. We created an educational presentation regarding the physical and mental effects and how patients could be affected by the lack of nursing breaks. We attempted to help them make changes, but due to the complexity of what goes on during a shift, we didn't see the results we hoped for. With the post-survey showing 90% having a better understanding of the situation and 100% saying they would encourage coworkers to take a break, we hope they will continue to work on ways to get the rest they deserve.
The QL process may not always be successful. However, the importance is that we stay proactive and recognize and find solutions to provide better care and services.